All right, have you looked in the mirror lately, or maybe you saw yourself in a holiday picture and thought, boy, I am looking tired, or I feel like I look older? Okay, fine. This is me. That's how I was feeling the whole holiday season. Help is here for us this morning. Dr. Melanie Palm has clearly found the fountain of youth and has some super easy ways for you to look younger, too. Dr. Palm, thanks so much for coming in.
Thank you for having me.
All right, where do we start? Because I'm looking at all these products, and you have my attention. That's
well,
for
Heather,
sure.
we'll kind of work from your side and go down. Okay. And I think one thing we talk a lot about at dermatology conferences are hair health. And there's a new supplement that's out that I think is really interesting that I really have started...
She called it the bomb. She's like,
off camera, it was the bomb. Yeah. But it's called Nutrafol. So I think it's sort of a derm secret. A lot of us are taking this for hair health. It has sort of the atomic bomb of antioxidants, biotin, which is really good for hair, skin, and health. But it's also got marine extracts and several other proteins that help stabilize cortisol levels, which are our stress hormone, which can kind of wreak havoc not only on our hair, but on our skin. But also helps sort of stabilize the lustrousness. Our hair is densest at 14 years of age, and then we start to lose it. And so anything we can do to kind of help with that, I think is wonderful.
It's a terrible thought that I will look the best I ever looked at 14. Face full of braces. All right, by the way, when I try something like this, right away, but realistically, how long will it take for me to notice a difference?
I tell most patients any sort of supplement, give it 3 to 6 months.
That long? Okay.
Yeah, to see results. And then I also included HelioCare, which is a really potent antioxidant, and I recommend that for melasma patients as a good anti-inflammatory, or people who have had multiple skin cancers. It's something I recommend as well. But kind of continuing along the hair vein, we talk about Latisse, and we were talking off camera how to use it.
I love Latisse. I'm telling you, it makes such a huge difference.
Yeah.
I didn't want to get into it because I don't want to pay for yet another thing, but to have a nice full set of lashes.
Yeah, so it helps with eyelash growth, and it's just applied to the upper eyelid, but many of us as board-certified dermatologists recommend patients actually use it on their upper brow as well. That area tends to thin over time, and we lose the number of eyelashes over time too, so this is a great way to kind of get falsies, but using sort of your body's own engineering to develop more of them.
It makes a huge difference. All right, let's talk about acne, because to get acne when I'm in my 30s and wrinkles at the same time is super frustrating.
Yeah, it's a double hit. You should get one or the other, and it's really not fair.
I want that stage to end.
Yeah.
But it's not, so what do we do?
So we actually, you can see a board-certified dermatologist, but if it's a wait to get in or you just don't have the opportunity to, for the first time ever, we actually have the first retinoid that's available over the counter. It's called Different.
Okay.
And we used to prescribe it a ton. It's the gentlest of the sort of Retin-A family of medications, and especially for women in their 30s, 40s, 50s and beyond that are dealing with acne. Not only does it help with the acne, but it helps with anti-aging. It builds collagen, it helps fight fine lines, it helps with pigmentation, it even sort of evens out tone as well.
Does it shrink pores?
It builds a little collagen, so it may camouflage it a little bit, but oftentimes procedures are involved to help with pore minimization.
All right, let's move on to, some of us are interested in needles or lasers, and what's kind of the latest and greatest with that?
Yeah, so I tell patients it starts with topical skincare at home, but if you're doing in-office procedures, I think a bit of a botulinum toxin such as Botox or Dysport, a little bit of filler if it's appropriate for the patient, and a little bit of sort of resurfacing with a light laser treatment to help with tone and texture. If you can use that as sort of a 6-month to once a year sort of maintenance, we can keep patients looking amazing for decades.
Wow. Okay.
Yeah, and there's lots of lovely new products. So, Botox we've been using off-label, which means not according to the indication for a long time, but finally, just in the last couple months, it actually got approved for the forehead. Or initially, it was just used just right here. That was the only on-label. But obviously, we use it in lots of other areas. Around the eyes, that just got approved in the last couple of years. But we use it around the mouth. We use it in the lower face. I love it in the neck for patients for preventative changes in the neck as well.
Wow. Okay. So good to know. A few questions to ask your dermatologist. Where can people go for more information or to get in touch with you?
Sure. There's lots of information on our website. It's artofskinmd.com. You can give us a call to 858-792-7546. And we'd be happy to answer your questions.
The number one thing, if people need to start some sort of skincare routine for the new year, what's the one thing that they should do?
Wear sunscreen if you're not, especially in San Diego. I know that sounds sort of mundane coming from the dermatologist, but truly, especially for lighter skin types, 90% of our sun damage comes from just day-to-day sort of wear. So you want to make sure you're protecting your skin.
Good advice. All right, Dr. Palm, thank you so much.
Thank you.
Michelle, let's get back over to you.
All right.